Hi, my name is David Nyland. I am a professor of social work at California State University, Sacramento in the United States. I also am the clinical director of the Gender Health Center, which is a nonprofit counseling agency in Sacramento that serves the transgender and queer communities. I'm going to talk a little bit about some of my ideas around sexuality and gender and some of my work with the transgender community that fits with many practices and ideas within narrative therapy. I'm also going to share a little bit about my ideas with a theoretical base, queer theory, and how it's congruent with narrative ideas. And then lastly, I'm going to talk a little bit about my work with William, a 16-year-old transgender man who came to see me because he wanted to start hormone therapy. So I'm going to show you a clip from that meeting. So to begin with, there is some very traditional notions around sex and gender in our society, in Western society, that basically that you are born with a biological sex, either male or female, and that is seen to cause your gender identity, with that being either masculinity or femininity, which is also then seen to cause your desire towards the other gender. It's seen as very congruent in a continuum with a binary, that being that sex is a biological category based on your genitalia or your hormones or your chromosomal structure, and that gender is a cultural or social category. A lot of queer theory, which I'm going to talk about, particularly the work of Judith Butler, challenges the very notion of this binary, whether it be sex or gender. Judith Butler talked about the heterosexual matrix, and what she's referring to is this continuum that is seen as seamless, that you have a fixed sex at birth, either male or female, and that leads to a gender identity which is built upon that sex, which then leads to and determines your desire, that being heterosexuality as the natural and normative sexual orientation. So again, you have a fixed body at birth, male or female, upon which culture builds a gender identity, which then determines your desire for the opposite sex. Butler's work in many of books, including Gender Trouble, many of her ideas were influenced by Michel Foucault. So her work smashes those links between sex, gender, and sexual orientation, suggesting that they're much more fluid and flexible and free-floating, and one is not caused by the other. There was really no stable factors. One of the main ideas that she's associated with is that gender is not natural, it's socially constructed. She also suggests that biological sex is not natural either. It's also socially constructed, that there's more than two sexes. The one way that she talks about shattering these connections is this so-called heterosexual matrix, is the myth that one is born with a body, and you may perform a multitude of gender identities, and you may have desire. So there's really no stable connection between the three. One does not determine the other. They're very free-floating and contradictory. She talks about gender being a performance. It's not who you are, but what you do at particular times. And so it's more about the way you perform your identity, your gender expression determines your gender. She also suggests that certain expressions of gender have achieved a hegemonic hold or seen as natural. And she suggests that certain expressions of gender that are seen as natural become normative practices in which any other gender performance is seen as less than not natural, so that our gender system is limited by what Foucault calls regulative discourses. A lot of her work built the basis for queer theory, which challenges those very notions of gender and sexuality, and it opens up debate for what our very notions of what constitutes maleness and femaleness, including sexuality. Is it our genitals? Is it hormone structure? Is it chromosomal structure? But the three are much more complex than what we thought. Some of her work led to examining the gender and sex binary. Now, let's say the gender binary, masculinity or femininity, male, female, that some of those binary categories have been useful in terms of social movements or identity politics, feminism. At the same time, that gender binary, male or female, also can operate to contain or regulate those identities. So for instance, once these categories are formulated and shaped by parents, families, social work, therapy, the mental health system, the criminal justice system, they're regulated in police, that any gender identity that is not seen as natural is policed and sanctioned, and at its very worst leads to violence. In my work with the transgender community, they illustrate through lived experience in their bodies challenging the very notion of stable and concrete identities and sexualities. So they, in a sense, illustrate the limitations of such binary systems. What I'm referring to by transgender is anybody whose gender assigned at birth does not fit, is not congruent with their gender identity. It can include somebody who wants to transition medically through hormones or surgery, often referred to as transsexual, but it can also include many different identities that are gender non-conforming, such as a drag queen, a cross-dresser, and anybody who lives a life that falls outside or challenges that gender binary. One of those identities is referred to as genderqueer. Genderqueer meaning a person, often a political identity, seeks to live outside our gender binary system and sees their gender expression as fluid and shifting depending on the context and a whole series of preferences. So in my work, working with the transgender community, it helps in my social justice work to begin to question our gender performances and to have some, in a sense, subversive action towards challenging our gender system. As it relates to my therapy work, I encourage in my work with therapists and supervising therapists to not necessarily abolish these identity categories, but to problematize them or denaturalize them, to deconstruct them, which is a tool often used in narrative therapy. Also, to speak more hesitantly and conditionally when we make generalizations of sexual identity or gender identity categories, and to be an ally towards any gender non-conforming person, a transgender person, anybody who transgresses our gender and sex norms, especially if you are a cisgender person. A cisgender person is spelled C-I-S, gender, cisgender, refers to, is defined as somebody whose sex at birth is congruent with their gender identity, anybody who is not transgender. So many of the people that I supervise are cisgender, and there's a great deal of work to look at one's cisgender privilege and to be an ally with the people I work who identify as transgender. Narrative therapy, I think, is really congruent and is seamless in its fit with working with the trans community. It's very, very congruent with queer theory in the sense of seeing gender as a construct, building and informed by postmodern theory and social constructionism. Much of my work that I've been trained in narrative therapy includes deconstructing gender identity categories, looking at issues of power and privilege, which is key to the work with the transgender community. It's very congruent with moving just outside of the therapy office towards more macro or community practices, which can include fighting for justice for transgender persons, changing some of our laws so that there is gender identity protection, no matter what one's gender expression or gender identity is, include healthcare rights for transgender persons. Some of the questions that I might ask when I'm working with somebody that's transgender is, instead of focusing on what the truth of their identity is, I might explore how they came to resist our gender norms. How did they stand up to transphobia? What qualities or skills did they take up in order to take these positions? And maybe who stands with them? It can be maybe a family member or a friend, somebody they've met in the transgender community who supports their gender identity and their intentions to live according to their preferences. It's been somewhat of a ethical dilemma for me, because in my role at the Gender Health Center, I am positioned as, quote, the expert. I am asked to do the assessments to determine a person's readiness for hormone therapy or sex reassignment surgery. And there's a set of, quote, best practices, unquote, called the Harry Benjamin Standards of Care. And these standards set the guidelines on what counts as a transgender person and what are the readiness and eligibility requirements for a person to begin hormone therapy or sex reassignment surgery. As it relates to hormone therapy, the standards of care require a person to go to therapy for a certain period of time, typically 3 months, and it also requires people to live out in public the gender identity that they identify with. This is referred to as real life experience, or RLE. So real life experience is intended if one wants to live in a gender identity that's other than the one they were assigned at birth, they need to live and express that gender in a public space so they can begin to experience what it's like to live in a gender other than the one they were assigned with. Now, there are of course some problems with real life experience, as there can be many situations where it'll be dangerous and put them at risk if they express their gender identity, their preferred identity, or there be if they are dressing in the ways that they prefer. For instance, a male-born person who dresses, quote, as a female, it could put them at risk in certain contexts, like at work or school, issues around what bathroom they're going to use, etc. So there's definitely some ethical dilemmas. I think the one that's most concerning to me is that I might need to diagnose a person I'm working with who wants to transition with gender identity disorder, which is a disorder that's in the Diagnostic Statistical Manual, the DSM, from the American Psychiatric Association's Diagnostic Manual. Gender identity disorder suggests that somebody who cross-identifies is innately disordered. And I and many people in the community are concerned with that diagnosis for a number of reasons, and yet we have to use that diagnosis in order for people to get access to much needed medical services such as hormones. The good news is there's a recent new standards of care that is eliminating the real life experience requirement and also moving towards eliminating the need to go to therapy in order to seek hormone services. So it's eliminating or moving towards the possibility that one does not need to go through a gatekeeper. That gatekeeper is a mental health professional who has the authority to determine whether one is, quote, truly transgender or not, if one is ready to begin hormone therapy. And even if those set of best practices were well intended, they're very problematic. It reproduces power and privilege of the mental health therapist, the psychiatrist, and of course it reinforces cisgender privileges. So there's good news that it's eliminating the real life experience, and also that a person may need not necessarily to go to therapy because they want to live in the gender identity that they feel congruent with and feels at home for them. In addition, they have eliminated the gender identity disorder, which is big news. It's good news that one's gender nonconformity expressions or identity is not innately, inherently pathological. Along with that, some good news in the next revision of the DSM is it's eliminating the category gender identity disorder. The new diagnosis or the new name is gender dysphoria, which is at least a step forward in that it suggests that one's gender identity, one's gender expression is not a disorder. It's only caused dysphoria because they're not able to live according to the gender identity that they identify with, they prefer, etc. It's good news at this time because our culture continues to privilege medical explanations. One might need to use that diagnosis, gender dysphoria, strategically to get the much needed services that they need. So I'm going to show a clip, excerpt of my work with William, a 16-year-old female-born person who is transitioning, living full-time as a male, and he wanted to start hormone therapy, testosterone. The session includes his mother. I was the consulting therapist. I was referred to see him for an evaluation to sign a letter saying that he's ready for hormones. The person who was working with him was also in the session, Deborah, and I had gotten a lot of information from Deborah in terms of William's courage and resistance to get to the point where he was ready to start hormone therapy. In the interview, he talked about his reason for starting hormones is that he felt, understandably, some incongruence with his body and the way it was developing, especially during puberty. And many trans teens I've worked with experience a great deal of depression and anxiety because their body is changing in ways that don't fit with their gender identity, their innate or their inside gender identity, their own personal psychological gender identity. And it feels, in a sense, as many people I've worked with, many teens, that it feels like their body is beginning to betray them. So hormones at age 16, especially for somebody who has been living as the gender that they identify with and they're very clear about it, such as William, it made a lot of sense. Unfortunately, which is not always the case, his mom was supportive in encouraging William to start hormones. So one of the questions I asked him is what his vision was for his own future gender identity, his gender expression. And he said he wanted basically to, quote, pass, unquote. And what passing refers to in the trans community is where one is able to, quote, pass as a female or as a male and be read completely as a male or female, whatever that means in a cultural context is up for debate and can be deconstructed. But he wanted to be, quote, read as a male in public so that he was able to go in the male toilet or male restroom, in that he wouldn't necessarily be questioned in terms of his gender identity, that he is a man. Includes changing his documents, birth certificate, driver's license to a male pronoun. one of the issues within the field is, if the goal for a transgender person is, quote, to pass, unquote, are they just replicating the gender binary? One of my colleagues wrote a book called Nobody Passes, and there is a certain relevance to the idea that in many ways no one really passes or fits with our culturally idealized form of gender, that we're all, on some degree, with transgender being at the far end of the continuum, sanctioned by our gender norms. However, in my work, which is very collaborative in privileging the client's experience, that if passing is the goal, then I honor that we may have conversations around deconstructing and beginning to understand their meaning of passing. And it's been my experience that when a person transitions, and even if they want to pass, it is not necessarily reproducing the gender binary. It is not an exact replica, and you'll see in the interview with William that his journey fits with the idea that he is not just replicating the gender binary, quote, from female to male. In a traditional assessment for somebody who's wanting to transition with hormones, the therapist is positioned as the expert or gatekeeper and is encouraged to do a traditional assessment, their history of their gender identity, ask them questions about if they know the effects of hormones, how long have they been living as a male, a whole series of expert-generated questions, one-sided questions, not a collaborative interview, to come to a, quote, diagnosis of gender identity disorder, and to make a decision that the person is, quote, a true, unquote, transgender person and can begin hormones, which then includes writing a letter that is used by a medical doctor to start hormone therapy. In my work, which is informed again by narrative therapy, I don't ask those questions. I truly believe, as many people in the gender community who are committed to transgender equality, is that everybody has a right to their own gender expression, and who am I as a cisgender person to challenge that gender expression, that gender identity. So instead of asking those more expert-driven questions, I'll ask questions informed by a lot of narrative practices, such as why am I not going to ask those questions? And every person I worked with, including William, can answer that question right away, and they say, because I know the questions you're going to ask and I've already thought about them. I've already thought about what my vision is for my own future, how I'm going to live my life out. They know the effects of hormones, so it seems rather problematic and reinforcing of gender politics to even ask those questions. That in a sense, he, in this case William, is the author of his own life. The main part of the interview then becomes a narrative interview about exploring their resistance to the gender system, how they came to know themselves in this way, who stands with them. I might ask questions such as, what kind of future do you envision for yourself in terms of your own gender expression, your own gender identity? What qualities or skills has it required for you to live your life in a way that fits with who you are? What kinds of experiences have you had that show this resistance and this courage? I also might ask questions of family members who are supportive. In this case, moms, who is very much an advocate and ally for William. I asked her a number of questions that pointed to her own history of challenging gender norms about what it meant to be a female. She was involved in the feminist movement in the 70s, so that helped create the context for William's gender identity others, and also a great deal of support from friends. He was also involved in the transgender community, going to many transgender groups and educating and supporting other young people who were becoming involved in the community, who began to see themselves as transgender, etc. Another question that I asked him in the interview, which you'll see, is what kind of masculinities do you want to perform in your gender transition? Which that question, I ask that question of all people I work with. However, with cisgender people, often cisgender men I'm referring to, they haven't thought about that question much. It's much more difficult for them to answer because they see their masculinity as, quote, natural. And cisgender people in particular are much more influenced by hegemonic masculinity. Hegemonic masculinity comes out of the work of R.W. Connell, who coined the term, borrowing from the term hegemony. His definition of hegemonic masculinity is the culturally idealized form of masculinity that emphasizes connecting masculinity to toughness and competitiveness, as well as subordination of women and the marginalization of gay men. Connell also suggests that it is not a fixed phenomenon, it's not static, but it's being contested, it's being shaped, it's historically situated, and it's a social practice. So what it means to be a man in contemporary California, where I live, might be very different from other notions of masculinity at any other time in history. Connell goes on to talk about that hegemonic masculinity includes the assumption that men as a group enjoy institutional privileges at the expense of women as a group. So it is examining one's power and privilege, male privilege, and that men do not share equally in the fruits of male privilege or patriarchy, that normative or heterosexual, hegemonic masculinity, usually white, upper middle class heterosexual masculinity, is constructed in relationship to feminities and is seen as the more privileged masculinity in relationship to feminities and more subordinated masculinities, such as African American or gay masculinity. Connell also talks about that hegemonic masculinity is very much at the heart of many problems in our society, including violence. Lastly, he says that men who perform and try to live up to hegemonic masculinity pay a price in terms of their relationships, their health, etc. So, in my conversation with William, I asked him what kinds of masculinities does he want to perform, and because he's lived as a woman in the culture, he knows he was born, assigned, quote, a girl, unquote, at birth. He understands the idea through lived experience that gender is constructed and that one performs gender. It's what you do, not who you are. And you'll see in the tape how he wants to take up certain masculinities that are in direct contradiction to hegemonic masculinity. He talks about how his dad and others that he knows are more informed by hegemonic masculinity, and that doesn't suit his preference. In my work, and this is a continuing evolution, I've begun to look at gender not necessarily as a social construction. There is a body, there is the materialization of the body, there is hormones, etc. And my work, where I have done a lot of work, consultation with transgender men, is that they notice with testosterone that it has real effects on their sexual desire, their moods. So I've begun to play around with this idea that maybe gender is not necessarily socially constructed completely, but it's socially exaggerated. It's socially exaggerated. So this accounts that hormones, whether it be for a transgender male, female to male testosterone, or for a male to female estrogen, that hormones do have real effects on the body. It's not so seamless, and there's many different ways that hormones can affect a person's moods, their sexual desire, their body, but I like the term gender as a socially exaggerated phenomenon. So I think that's it. I'll show the tape now. Thank you.